Okay, so now we are going to look at the common functions of cerebellum that are very important. It helps in motor learning, sense of the body positioning, balance, and equilibrium, and fine movement and coordination. Now, if cerebellum is impaired, what actions can be present, what findings will be there if cerebellum lesion will be there. Okay, cerebellar lesion can be result with the findings like dysdiadochokinesia, ataxia, nystagmus, intentional tremors will be there. Okay, ataxia will be there, means positioning movement will be impaired. Nystagmus will be there. Intentional tremors, scanning speech, and hypotonia will be there in cerebral lesions. Cerebellar lesions. Cerebellum has the function of movement, control, and also the position of body. So ataxia will be there, dysdiadochokinesia, and scanning speech with hypotonia will be there. So in ataxia, there will be loss of position. A person cannot sense the position or cannot maintain the position. It occurs uh, because of certain things like spinocerebellar lesion will be there, and a pontocerebellar lesion that is involved in coordination, and vestibulocerebellar lesion or flocculonodular lobe that results into the nystagmus. So these are some of the findings that are because of cerebellar lesion. As you can see here in the lesion of anterior lobe of cerebellum, posterior and flocculonodular lobe results into the nystagmus. So there are certain diseases that can cause cerebellar lesion like Friedreich ataxia, spinocerebellar ataxia, mitochondrial disorders like Fragile X syndrome, and multiple systemic atrophies can result into the cerebellar lesions. As I already mentioned, that cerebral lesions result in the ataxia, dysarthria, dysphagia, abnormal eye movement, nystagmus due to flocculonodular lobe, and steady gait, exaggeration, heel to toe walking that results in the cerebellar disorders, and a person can present with the findings of ataxia and the tremor and dysdiadochokinesia and cerebellar lesions. As you can see, there are wide range of disorders related to cerebellum like acquired disorders of tumor, infarct or hemorrhage, malformation like different syndromes, and genetic disorders like ataxia, telangiectasia, spinocerebellar ataxia, Fragile X syndrome, Digeorge syndrome 22q11, and ADHD. So these are some of the syndromes